When discussing brain-computer interfaces, or BCIs, the spotlight almost always lands on Elon Musk and Neuralink's long-term goals of human-AI symbiosis and digital telepathy. Behind the scenes, Science Corporation has quietly reached a $1.5 billion valuation. The company was founded in 2021 by Max Hodak, who previously served as president of Neuralink. The two companies operate on entirely different timelines. While Neuralink focuses on the complex, long-term challenge of merging human cognition with artificial intelligence, Science Corporation is executing a medical-first strategy designed for immediate clinical application. The entire neurotech industry faces a massive biological bottleneck. Invasive brain surgery is inherently dangerous. Drilling into the skull carries immense risk, which creates severe regulatory gridlock with the FDA, the Food and Drug Administration, the U.S. agency responsible for approving medical devices. Taking the lead in the neurotech industry right now requires three things: addressing an urgent medical condition, proving the technology works safely, and securing regulatory approval fast. Science Corporation chose human vision as their starting line. Biologically, the retina is an extension of the brain, making it a direct anatomical line to the central nervous system. By utilizing the eye as an indirect brain interface, surgeons can implant a device without ever opening the patient's skull. This drastically reduces the surgical danger and removes the biggest barrier to early regulatory approval. Their lead product is called PRIMA. It is a wireless 2x2mm photovoltaic chip that is surgically placed directly under the retina. The patient wears specialized glasses equipped with a built-in camera. These glasses project infrared light patterns directly onto the implanted chip, which then stimulates the remaining healthy nerve cells to send visual signals down the optic nerve. This chart shows the clinical results published in the New England Journal of Medicine in 2025. It illustrates that 80% of functionally blind patients with advanced AMD, age-related macular degeneration, a disease that destroys the central portion of the retina, regained enough vision to read letters and complete crossword puzzles. Testing whether a patient can read a letter provides a clear, undeniable clinical endpoint. Proving a device restores sight offers a much faster route to commercialization than trying to measure abstract cognitive enhancements. For patients whose photoreceptors are entirely destroyed, a standard chip cannot process the incoming light. To address this, the company developed a secondary internal project called the Science Eye. This approach relies on optogenetics. Optogenetics is a biological technique that uses gene therapy to mutate dead zone retinal cells to become sensitive to light again. Once those cells are genetically modified, an ultra-dense, flexible micro-LED film is placed over the retina. This hardware layer drives the newly sensitive cells with exact precision. By developing both a hardware chip and a gene therapy solution, Science is aggressively hedging its bets. If one method faces technical or regulatory delays, the other can still reach the market. Restoring sight provides the necessary cash flow and regulatory footing for a much broader roadmap in neural engineering and biological life extension. Traditional implants rely on rigid metal electrodes. Over time, these materials cause inflammation, tissue damage, and eventual rejection by the body's immune system. To solve this, the company is developing the Science Biohybrid. Instead of metal hardware, this system uses living, engineered neurons that naturally grow into and integrate seamlessly with human brain tissue, offering higher bandwidth and a longer operational lifespan. They are also building the Science Vessel. This is an advanced perfusion system inspired by ECMO, extracorporeal membrane oxygenation, a machine that pumps and oxygenates a patient's blood outside the body. The vessel is designed to automate and extend life support, from a few days to months or even years. Projects like the Biohybrid and the Vessel push the company far beyond niche vision restoration. They are actively engineering systems for long-term biological integration and sustained human life support. The long-term business strategy relies on two internal assets: their manufacturing foundry and the Synapse API. An API, or Application Programming Interface, is a set of rules that lets different software applications communicate with each other. Rather than keeping these assets internal, Science sells its proprietary microfabrication tools and software infrastructure to outside researchers and competing startups. This creates a business model similar to Amazon Web Services. They are supplying the foundational hardware and software that the entire next generation of neurotech companies will depend on to function. This roadmap carries heavy risks. The timeline is vulnerable to unpredictable FDA delays. Optogenetics raises significant ethical and safety concerns regarding gene therapy, and extending life support states indefinitely opens complex moral debates. While competitors capture the public's attention with distant promises of telepathy and artificial intelligence symbiosis, Science Corporation is executing a practical strategy. By targeting specific medical conditions, securing clinical endpoints, and selling the underlying infrastructure, they are quietly positioning themselves to dominate the 21st century medical industry.